I get to kick cancer's butt and give people back their lives, because cancer is ugly, but taking care of people with cancer is beautiful.
The courage of my patients is a daily renewing resource for me. I do feel like we can help virtually every single patient that walks into our clinic, and that's intensely rewarding.
It's been really awesome to be able to make a difference for more people.
Having somebody who is fearful and, facing into this tough place, but then being able to bring them out the other side and have a successful outcome. I think that's what, we all hope for, and obviously it's not the case all the time, but it definitely keeps you coming back.
It's those moments where I can leave that exam room and say, this is all worth it. It's tough, but it's very rewarding for me, and I feel satisfaction in knowing that I can help people through very challenging times.
Whatever the goal is, that's my goal. So I'll work with you on how do we achieve that goal? Is it certain medication changes? Is it nutrition choices? Is it things you want to add in? Is it things you want to take away from your diet? And then how do we actually do that? What does that look like?
It's important to take what joy we can from what we're able to give, even in situations that are hard.
We all have a role to play. I think it really does come together in a way that hopefully helps people, feel cared for every step of the way.
The continuity of care is one of the things that originally attracted me to the field. And it has also kind of kept me in the field because it's just great to see those faces, to see the triumphs.
I get to see people who are at one of the hardest, scariest times of their lives, and I get to walk them through their journey and get to see them on the other side of it, where they're experiencing their lives and in their excitements, and I get to see them through the whole process.
Having their trust in our team is huge, especially because, when we're first meeting them, we're strangers to them. It's a process. It's not just one visit.
When you get to know each of the individuals on the team, they have so much heart. They care so much about the patients. Some of the people that I work with have gone through a lot themselves, and they're especially empathetic.
I love being in the operating room. I love doing surgery, but really it's what comes after that for me that really brings me the most satisfaction.
It's great to be an oncologist because you make a difference in people's lives. You provide hope and meaning for patients.
My role is to help them through, to see through that there is life beyond cancer, that they can come out stronger and healthier and with more appreciation of life. And that's when I feel my job is successful.
What keeps me being drawn to medical oncology is the relationships with patients and the deep trust that they place. That's very rewarding.
I always like to continue to see my patients and engage with them and follow up, both for seeing obviously how they're doing, but then also making sure that we're managing any side effects that may come up later on down the road.
It's not so much random that we advise people to go on a clinical trial. It has to do more with an understanding about them as a patient and their cancer in its biology.
What I find to be really meaningful is, even if we're still in the process of figuring things out, that people walk out knowing what the next step is and knowing, what they can do about it.
Well, I like the intellectual challenge of making diagnoses, but more important than that is the ability to provide support for patients and their families as they go through the most challenging experience of their lives.
Seeing that kind of transformation through the process of actually becoming stronger through your cancer journey, people absolutely do that. And so that brings me a lot of joy.
Just being able to be there for patients when they're going through the hardest of times. There's not always something that I can do, like physically do, but being there to listen, being there to hold someone's hand, just being present, I think is really important.
I think Compass stays cutting edge in how they provide care for patients based on our research program, our pharmaceutical committee that really makes sure that we are providing the latest and greatest care and also the standard of care.
Taking care of patients in the setting of cancer and blood specialty is it's a pretty awesome experience. You
are very connected patients. You get to take care of them, know them and their family. The care extends to their emotional well-being.
My favorite thing about my job is the relationship that we develop with our patients. I'm seeing the patients at least once a week, oftentimes more often, and we really develop a close relationship and get to know each other.
I think just the most important thing is just awareness and knowing that, hey, there's options out there other than just, typical recommendation.
Being able to help patients through the difficult journey, being able to help them, advocate for them, and make it easier, whatever it may be.
Many times people are afraid to talk about hard things or death or the loss of a loved one or grief. And I do feel called to be with people, to walk with them in that grief.
It's an honor and it's a privilege to be able to kind of be in those intimate moments and those tough conversations, and also celebrate just really amazing victories with people.
I always try to treat my patients like friends and family. And I always like to leave them with hope.
I like caring for the patients. All of them are so kind and come in some of the most difficult times of their lives. And I like being able to meet them in that and walk them through it and kind of be a face of comfort and someone that they can trust.
When I go to work every day, I'm inspired by their resilience, their hope, and our joint mission to try and make their life as best as possible and cure them if possible. And I'm super energized by their motivation, and that is what charges me to deliver the best care that I can every day.
All of the things that happened when I went through breast cancer diagnosis and treatment, they were all positive. It was hard, gave me a different perspective on life, and I lived my life differently because of it.
Many of the cancer patients are curable now. Okay, so even for those people who are not curable, we can make their life better. Okay, we can do things to make their life better, and that's very satisfying.
These are people, and they have lives, and they have loved ones, and desires, and dreams, and they're afraid, and you really want to recognize that and honor that, and really try for them. It is personal for them, so you make it personal for you.
Seeing their family come in to provide their love and support, it's a blessing. And I think it's an honor to be able to work with this group and to work with these patients.
I think it's important to find the little victories in each day. And some days they're much bigger than others, but other days they're nonetheless smaller, but very, very important, particularly for patients.
My favorite thing about working in palliative care, specifically at Compass, where I get to work with patients on an outpatient basis and get to know them for months and years, is the relationship.
I'm not exaggerating when I say that, my patients are the strongest people I know.
Many times patients feel like that they lose control when cancer, and then all these imposing forces are upon them they didn't ask for. And I try to give them as much power back as I can in making decisions about their health care.
We meet so many inspiring people who have lived just these amazing lives. And so when I get to talk to them and hear their stories and be there as a source of support for them, it makes the hardest days worth it and the good days that much better.
Really seeing those wins, when we have a patient that we cure, or we have a patient that we help die with dignity, those are really rewarding moments.
I love the fact that, if nothing else, at the end of the day, I'm dead tired, it's been a rough day, but at the end of the day, I go home feeling like I made a difference, even if it was just a small difference.